Meeting call to order.
Good evening, everybody.
Good evening.
Absence of Rotarian Secretary Rotarian Pratul Agarwal, I will be conducting today's meeting. I request the President Rotarian Lal Goyal to confirm the minutes of the previous meeting.
The previous meetings minutes were circulated, and as we have not received any objection or observation, so I presume that everybody has confirmed. So I hereby confirm the minutes of the previous meeting. Now, before we will go for the next agenda, I would like to inform you that we received a message from District Governor Chetan Desai of RID 3141, and the message says, "Dear Vibrant Presidents, this is to inform you that PDG Rotarian Harjeet Singh Talwar has been elected from RID 3141 as the 2025-26 RI Director, nominating committee member. Total valid votes 208, votes in favor of PDG Harjeet Singh Talwar 116, votes in favor of PDG Sandeep Agrawala 92. Best regards, DG Chetan Desai, RID 3141. And we are happy to inform you that our board of our club has recommended only his name of Rotarian Harjeet Singh. So we have voted for him yesterday. So that's over from my side. Over to you, Rotarian Ruby Agrawal.
Thank you, and congratulations to Rotarian Harjeet. Now, our topic today is role of psycho-oncologist in organ donation. And we are delighted to have two guests today speaking on this subject. I request Rotarian Girdhari Agarwal ji to please introduce the guest.
Thank you, Ruby Agrawal. It is a pleasure to introduce two eminent guests in our club today. Mr. Justin Titus. He is a dedicated psycho-oncologist on a mission to transform mental health care. He completed MSc in applied psychology along with specialized training in psycho-oncology. That is, in the bracket it says PGDPO. I don't understand what it is. And MSc Cancer Survivorship from Trinity College, Dublin. Mr. Justin is a certified practitioner of the MIT BCCT and a member of Counselors Council of India, Indian Counseling Psychology Association, IPOS, IPSON, postgraduate member of the PSI and a non-oncology member of ASCO. He is currently working as a brain injury rehabilitation specialist in Dublin and psycho-oncology and COO at Psycan. Sorry. And another guest we are having now is Ms. Asa Saxena. She is a psycho-oncologist, the founder and director of Psycan Manovaha Private Limited. Ms. Asta is a member of the Counselors Council of India, IPOS, and non-oncology member of ASCO. She was trained in Rajiv Gandhi Cancer Institute and Research Center, New Delhi, and Metro Hospital and Cancer Institute, Preet Vihar, Delhi. She worked as a former consultant psycho-oncologist in Metro Cancer Institute, Faridabad. Ms. Asta was facilitated as a Young Achievers Award by a Business World 30 under 30 years. Very nice.
Thank you, sir.
Thank you for your kind words, sir, and a warm welcome.
So I think already the introduction has been given, so you can start your presentation, please.
Yeah.
Over to you, Ms. Asta.
Give me a minute.
Yeah, please start your presentation. Thank you.
Is my screen visible?
Not yet.
I guess it is visible now.
Yes, please. First, just enlarge it, make it full screen. Yes.
Good evening to all the members of Rotary Club of Organ Donation International and to everyone watching us live. On behalf of Justin and myself, I would like to express our sincere gratitude to Rotarian Lal Goyal sir, Rotarian Pratul Agarwal sir, and Rotarian Gidhari sir for providing us this incredible opportunity. Today, we will be discussing the intersection of organ donation and psycho-oncology with a focus of understanding the psychological, ethical, and medical aspects of organ donation in cancer patients. With that, I would like to invite Justin to begin with the presentation.
Good evening, everyone. Thank you for taking the time to join us in this important discussion on the intersection of organ donation and psycho-oncology. My name is Justin Titus. Myself and Asa are really honored to guide you through this session. And as we move on through the session, feel free to share your thoughts or ask your questions. Let's make this an engaging and collaborative discussion. And once again, thank you for being here. We truly appreciate your presence. Let's get started. Move to the next slide, Asa. Yeah. So as you can actually see from this slide, the organ donation is one of the most impactful ways to save and improve lives. It offers a second chance to the patients suffering from organ failure, including those whose organs are affected by cancer or its treatment. However, cancer complicates the organ donation processes. Some cancer patients can safely donate, while the other face restrictions due to the risk of disease transmission. At the same time, cancer is not just a physical disease, it is deeply emotional and psychological consequencing diseases. Patients and their family members often struggle with difficult choices, fear, ethical concerns, and especially related to the organ donation. Some may want to donate but are unsure if they are eligible, while others may need an organ and face long waiting times. The intersection of cancer care and organ donation brings up critical medical, ethical, and psychological questions, such as can cancer patients donate organs safely? Should cancer survivors register as donors? Or how does emotional well-being affect the donation decisions? So in this presentation, we will explore the global and the Indian statistics in organ donation and its role in cancer treatments. The challenges faced in the donation eligibility for cancer patients and how psycho-oncology helps patients navigate through these decisions with clarity and emotional resilience. Moving on to the next slide, here we can see the global statistics on organ donation. Organ donation is a critical medical intervention that saves lives, yet there's a significant gap between demand and availability. More than 1.5 million people globally are waiting for organ transplants, but the donor shortage remains a major challenge. Only about 10% of the global need is met each year, leaving countless patients without access to life-saving procedures. A key factor affecting the donation rates is whether a country follows the opt-in or the opt-out system. For example, our country have an opt-in system. We'll discuss about that further. Looking into the case of Spain, which has the highest donor rate in the world, nearly 48 donors per million people, that operates under an opt-out system where all the citizens who are presumed donors unless they are opt-out legally. The UK follows a similar model. In contrast, countries like India and the US require individuals to actively register as organ donors, resulting in lower donor rates. While organ donation is vital, cancer patients face additional challenges. In some cases, the cancer survivors may be eligible to donate organs, but strictly the medical guidelines limit their availability to do so. Likewise, cancer patients need organ transplants often struggle with longer wait times due to the prioritization protocols that we have in place. Understanding these global trends is so crucial in addressing the donations shortages, improving the accessibility, and to ensure equitable organ allocations for patients, including those affected by cancer and metastatic cancer. Moving on to the next slide, here we can see the organ donation in India and the current scenario. Despite medical advancements throughout the last 2-3 decades, India continues to fear a severe shortage of organ donors with a donation rate of just 0.86 per million people, which is one of the lowest in the world. This has left thousands of patients, including cancer patients, waiting for life-saving transplants. For cancer patients, the need for transplants rises when treatments like chemotherapy and radiation cause irreversible damage to their significant organs, such as liver and kidney. However, they face additional challenges due to the concerns about cancer recurrences or the eligibility criteria for the transplantation, which make it even more complicated. Beyond these medical challenges, the societal factors play a crucial role. Lack of awareness, the deep-rooted cultural and religious beliefs, and the gaps in the national policies have slowed down the organ donation efforts. Many families hesitate to donate organs due to the misconceptions about the process and the emotional distresses. These factors combined make it crucial to improve education, streamlined donation policies, and strengthening India's transplant infrastructure to ensure better access to organs for those in need. Moving on to the next slide, here we discuss about the role of psycho-oncology. Can you move to the next slide, Asta?
Yeah.
Thank you. So, psycho-oncology, which is a relatively new mainline stream of cancer treatment, is a specialized field that focuses on how cancer affects a patient's mental and emotional well-being. A cancer diagnosis, as you might know, it is life-changing, bringing with a very numerous amount of psychological challenges like anxiety, depression, and distress about the future. Patients may struggle with fear of death, anxiety about the treatment outcomes, and other concerns about their quality of life, other family concerns, and the socio-cultural factors can be an uncertainty. For those considering organ transplantation, these concerns become even more complex. The decision to undergo a transplant involves not just the medical risk, but also emotional and ethical dilemmas. Here is where the psycho-oncologists step in. As psycho-oncologists, we help the patients process these feelings, ensuring they are mentally prepared for the procedure, and we will be also supporting the families and the caretakers who may experience the stress, the guilt, or the fear related to organ donation and transplantation. By integrating the psychological care with the cancer treatment, psycho-oncology improves patient outcomes, foster a better decision-making by involving both the patient and their caretakers, and to enhance their overall quality of life and their well-being. Moving on to the next slide, here we discuss why the organ donation is important in the cancer treatment. Organ transplantation is often a life-saving option for cancer patients, especially those whose diseases or treatment have severely damaged their organs like liver or kidney. For example, liver cancer and kidney cancer can directly destroy the organ's function, and making it dysfunctional, making the transplant the only viable solution. In such cases, in cases like hepatocellular carcinoma, the liver transplants have shown really good promising long-term survival rates, about 50% when performed at the early stages. However, it is not just the cancer itself, but the treatments like the chemotherapy or the radiation can also lead to several organ failures over time. In such cases, transplantation can significantly improve both the survival chances and the quality of life of the cancer patient. Despite of its benefits, the organ donation in cancer patients come with a lot of ethical dilemmas. Like, should cancer patients receive a priority in the transplant list? Can cancer survivors safely donate organs? These questions are essential to balance the medical advancements with ethical considerations. Moving into the next slide, here I would like to introduce a new stream of cancer treatment, which is called as transplant oncology, which is a newly emerging and rapidly growing field that combining cancer treatment with organ transplantation. The primary goal is to use transplantation as a curative approach for certain cancers, particularly those affecting the liver. For example, the liver transplants for hepatocellular carcinoma have shown higher survival rates. for selected patients. However, one of the biggest challenges in transplant oncology is the risk of cancer recurrences or the metastasis. The patients who receive the organ transplant must take immunosuppressive drugs to prevent the organ rejection, but these medications can also weaken the body's ability to fight the residual cancer cells. This delicate balance between preventing an organ rejection and minimizing the cancer relapse is a key area in the research of transplant oncology. Now, I would like to invite Asa to continue the presentation.
Thank you, Justin. Now, we will be talking about challenges and limitation in organ donation for cancer patients. Here, I will be covering three parameters that will be medical barriers, psychological barriers, and ethical and social barriers. Medical barriers: not all cancer patients qualify for organ transplantation. One major concern is the risk of cancer transmission through donated organs, particularly in cases where cancer has spread, like stage 4 cancers or metastasized cancer. Additionally, cancer treatments like chemotherapy and radiation therapy can cause long term damage to organs, making them less viable for transplantation. Second is psychological barriers. The decisions to undergo or donate an organ involves significant emotional stress. Patient may struggle fear and uncertain about the procedure, while families of deceased donor may experience survivor's guilt, questioning whether they made the right decision. Third comes the ethical and social barriers. With a global shortage of donor organs, prioritization become a challenge. Should cancer patient be given the same access as those with non-cancerous organ failure? Addressing these challenges require educational, policy changes, and psychological support for patients and family. Next is the role of psycho-oncologist in organ donation. Psycho-oncologists play a crucial role in supporting cancer patients and their families through the process of organ donation, whether they are potential donors or recipients. Emotional support for patients and families. The decision to donate or receive an organ can be emotionally overwhelming. Cancer patients may struggle feeling of uncertainty, while potential donors and their family may experience anxiety and grief. Psycho-oncologists provide counseling to help individuals process their emotions, navigate the complex psychological aspects of the organ donation. Second is informed decision making. Many individuals have misconception about organ donation, such as fear of organ misuse or doubts about eligibility. Psycho-oncologists help clarify these issues, ensuring patients and families make informed choice based on the facts rather than the fear. Third comes the family support and ethical consideration. For donor families, the process can bring grief, survivor's guilt, or ethical dilemma. They may struggle with the idea of losing loved one while saving the another one. Psycho-oncologists offer grief counseling, helping families finding meaning and closure in their decision. Fourth is collaboration with teams. Psycho-oncologists work alongside oncologists, palliative care teams, transplant coordinators, social workers to provide a holistic approach care. Their role is essential in ensuring that emotional and psychological aspects of organ donation are addressed alongside medical and ethical consideration. By integrating mental health support in the organ donation process, psycho-oncologists contribute to better patient outcome, improve family well-being, and greater awareness of the importance of organ donation. Next, we have psychological and ethical consideration in organ donation. Organ donation, particularly in the context of cancer treatment, goes beyond medical consideration. It involves deep psychological and ethical challenges for both donor and recipients. There are some kind of emotions that they go through. Donation anxiety. Living donors often experience fear about the surgical risk and the long term impact on their health. Families of deceased donor may struggle with grief, regret, or uncertainty whether their loved one's organ should be donated, especially to the good patient, cancer patient. Second is guilt in recipients. Many recipients feel an emotional burden knowing that their organ come from someone else's loss. Some may struggle with survivor's guilt, questioning that they received a life-saving organ while other did not. Next come the ethical dilemma. Organ allocation remains a controversial topic. With a shortage of organ donors, there is a debate over whether cancer patients should receive priority given the risk of recurrence. Some argues that organs should go to the patient with higher survival chances, while others emphasize equity in healthcare access for cancer patients and needing transplants. Different countries have varying medical policies on this issue, reflecting the complexity of organ donating ethics. Then comes the role of psycho-oncologist. Support living donors by helping them process fear and concern before surgery, providing counseling to the families of deceased donor, easing grief and emotional conflict. Help recipients manage guilt, anxiety, and psychological impact of receiving an organ. Facilitate ethical decision making, ensuring patient and families make informed and emotional sound choices. This highlights how psycho-oncology plays a crucial role in organ donation, addressing emotional and ethical barriers that can impact both donors and recipients. Next, we have the future of organ donation and psycho-oncology integration. The future of organ donation and psycho-oncology is evolving rapidly, offering new hope for cancer patients who need life-saving transplant while addressing the psychological barriers associated with donation. So there are some advancement in the therapies also, like advancement in immunotherapy. One of the biggest challenges in cancer patient becoming organ donors or recipient is the risk of cancer recurrence. Immunosuppressive drugs used after transplantation can reduce the body's ability to fight cancer cells, making cancer survival less eligible for donation or transplant. So, new immunotherapy approaches are being researched to suppress organ rejection without increasing cancer risk, allowing more cancer survivors to donate or receive organs. There is more, again, there is more new approach, that is artificial organ development and bioengineering. Scientists are working on bioengineered livers, kidney, and even heart tissues, reducing dependency on human donors. If successful, artificial organs could be a big breakthrough for cancer patients who often face challenges with traditional organ donation due to their medical history. Stronger psychological support system. As organ donation awareness grows, so does the need for a better mental health support for donors and recipients. Structured psycho-oncology program will help. It will help living donors manage anxiety before and after donation. Families of deceased donor cope with grief and decision-making stress. Then comes recipients overcome survivor's guilt and mental health challenges post-transplant. Researchers suggest that mental health support improves organ donation rate by addressing emotional barriers that often prevent people from registering as donors. With advancement in medical science and psychological care, the future of organ donation in cancer treatment looks promising. By integrating psycho-oncology into transplant programs, we can improve patient well-being, and increase donor participation, and ultimately, unlimitedly save more lives. Next is the key takeaways and final thoughts. Organ donation is crucial for cancer patients. Many cancer patients experience organ failure due to the disease or its treatment. Transplantation offers hope, but cancer patients often face eligibility concern due to recurrence risk. As we all know, the cancer patient, even after a remission of 10 to 15 years, they will still have the fear of recurrence and they'll live their whole life in the fear of recurrence. Increased organ donation rates can give cancer patients a second chance at life. There are some psychological barriers that must be addressed. Many people hesitate to register as organ donors due to fear and misinformation. Recipients often struggle with survivor's guilt, anxiety, and uncertainty about post transplant life. Tackling these barriers through awareness, counseling, support groups can improve donor participation and transplant success rate. Then again comes the role of psycho-oncologist. Psycho-oncologists support cancer patients and families through the complex organ donation process. They help patients navigate fear, misconception, ethical concerns about organ donation and transplantation. Their roles ensure a holistic approach integrating medical treatment with psychological well-being. The future of organ donation in cancer lies not just in the medical advancement, but also in a strong psychological support system. By bridging the gap between medical science and mental health, we can encourage more and more organ donors, support recipient better, and ultimately save more lives. Then we have the conclusion. this is the part I would like to introduce my company, which is, as Sir introduced, Psycho-Oncologist Private Limited. It's an online platform for mental health services, and we have psychiatrists and psychologists. And psychologists, they all are specialized in different specialization, like psycho-oncologist, clinical psychologist, child psychologist, and sports psychologists are also there. Some counselors are also there, and we are making a platform where this platform is launched for Pan India, and we are getting practitioners from Pan India too, where we want to have more and more. We want to create more awareness around mental health, because as we can see here also, mental health is related to all the fields, irrespective of the department, or irrespective of the nature of the problem. It's related everywhere. Like here in the organ donation is there, in the cancer field is there, it's there for the child, it's there in the school counseling are there, organizational psychology is there. So psycan is there to make a difference. Psycan focuses on mental health and emotional well-being, offering counseling, education, and awareness program for individuals facing difficulty-related decision making. We can help patients and families navigate fears, anxieties, and ethical dilemma around organ donation. By bridging the gap between medical science and emotional support, Psycan empowers to make informed, stress-free choices, including organ donation. So here I would like to conclude with one thing. We can create a future where organ donation is widely accepted, mental health is prioritized, and more lives can be saved. Next slide is the references that we have used. And thank you. Thank you all for all your attention. I hope this discussion has provided valuable insight into the intersection of organ donation and psycho-oncology. Now we would love to hear your thoughts or answer any questions that you might have.
Thank you very much, Ms. Saxena. Can you just close the?
Yeah.
Thank you very much, Ms. Saxena, as Mr. Justin, for giving us the information about the organ donation, and especially for the cancer patients. Now, there are many things which are coming in the mind, but a few things which I would like to know from you. When you are saying that the counseling is very important, and especially the psycho-oncologist counseling. So when we have the organ donation counselors in the hospital where the transplants are taking place, is any proposal is there, or already the psycho-oncologists are there in the as a counselor working in the hospitals in India or not?
Sir, mostly psycho-oncologists you will find in the south states. But when it comes to north, we don't have much psychologists there. And even after completing our qualification in the psycho-oncology, I and Justin, we actually explored the whole India kind of to find a job which was actually respectful, and where we can start our practice the way we want. So yeah, I can say there are less number of job opportunity for psycho-oncologists. So that's why I said, like with as we said, the organ donation, lack of information, people does not know about it. Same goes for psycho-oncology and the mental health. People does not want to talk about it, even when the courses are there in the universities. But we don't have a setup to work in the hospital setups.
Okay, so thank you very much, and really it's a good new start, because in India so many cancer patients, and one of our member is suffering. I will not name him, although our members knows him. Is with the liver cancer, and he's under chemotherapy and following with the injection. So, but it is definitely a life-changing thing. Only thing is that I would like to call, if he's there, Mr. Nitin, are you there, Rotarian Nitin? If you are there, please switch on your video, Rotarian Nitin, because Rotarian Nitin got a transplant of kidney in USA, and he has to wait because of some issues. If he can tell himself, Rotarian Nitin, are you there? If you are there, please switch on your video. I think he will, once he will be, because it's quite early there in San Francisco. Okay, so now I'm opening it for the questions, and I would first I'll ask Dr. Rohan Monis to ask a question to these two very young panelists. And I will tell Dr. Monis and all other members, only day before yesterday, they were in touch with me through someone, and I immediately talked to her. And when I told her that you be able to present, and I gave this topic because I was not knowing about this particular field, to be very frank. But when I searched, then I found that this is a good topic, and I gave this topic to her, and immediately she accepted. Yes, this is a good topic. We would like to speak, and we will make the PPT presentation. I was thinking that it will be ordinary PPT presentation copied from here and there. But today's PPT presentation, I'm sure the members have liked it, and I can see Rotary Nitin is there. Rotary Nitin, can you just tell about yourself, why you have to wait for so long for the kidney transplant in USA, and what is your take about this on this today's topic?
Yes, thank you for involving me. So basically, what the speakers just said, like because of the cancer, the drugs that are given have the tendency to have the cancer regrow in your body. So I had kidney cancer, and basically it was constrained in the organ, one of the kidneys itself. So once it was removed, I was okay. I didn't have to go for subsequent cancer treatment. But basically, there's a waiting period to be cancer free before you could accept an organ. So I had to wait for 5 years, more than 5 years. Minimum is 5 years. So basically, they won't put you in the green signal line for the kidney transplant unless you complete 5 years. So that was the issue. And of course, there's a medical research because of the anti rejection drugs that have to be taken lifelong. They tend to have cancers regrow. So that would have been the reason. Yeah.
Ms. Saxena, would you like to comment on what Rotary Nitin says? Because in USA, if anybody suffered from the cancer, and even that one kidney was removed, but they cannot do the transplant until unless the 5 year schooling period is over. Have you come across the same law in India or such type of things?
Cancer treatments and the protocols are almost same everywhere. So as I said, once the person is need to be cancer free, because these are the criteria. If the person is not cancer free, or if the remission period is not too much, then because due to the immune, all these therapies, chemotherapy and radiation therapy, there are chances that they won't, even after the transplant and everything, the recurrence chances are more. That's why, even as I said, the protocols are different for organ transplantation everywhere. So people like to wait. As I said, even there was a point in my presentation where it was said that we need to think whether can we prioritize the cancer patient or not, because there's a fear of recurrence, right?
So, but the prioritization is not in this case, because he has to wait for 5 years. So it is not like this that somebody is suffering from cancer, so he will be given priority for the organ transplant. What do you say about this, Mr. Justin?
So I would actually like to say that there is a significant difference between the opt-in and the opt-out system. Just like I mentioned in my presentation, we have an opt-in system in India, so do in the US. That literally make us being like one of the least, or we will be actually in the bottom list in terms of having more donors per million people, which means that people need to actively sign up or register to donate their organ after their death. Whereas in the opt-out system, that is commonly seen in most of the European countries, especially in Spain.
Mr. Justin, can I stop you here? We
Yeah,
are not talking about opt-in, opt-out system. We all know about opt-in, opt-out system. What the point Rotary Nitin has raised is that because he was suffering from the cancer, and then once he was cancer-free, there is a cooling period of 5 years. Only then they allow the transplant. While in your presentation, you have presented that the cancer patient should be given priority with so that he or she will get the organ as early as possible. So that's what I want to know. Ms. Ashta, can you just highlight this thing, what we are asking for? Ms. Saxena, sorry.
Oh. So I think, as I said, this transition period or the recovery period is too much. I don't want to offend anyone here right now because sir is already, he has deal with it. But when a patient is suffering from cancer, even after the researches and everything, the uncertainty is there. What I think is, instead of, as a practitioner also, maybe all the guidelines, even after looking everything, they might be looking for certain periods and the signs that the patient is cancer free, and the reaction and the adverse effect of the chemotherapy and radiations are cooled down now, and
So,
the chances of recurrence is quite lesser, and after the period of 5
so it is against the priority thing, because what you are saying and what we also understand, that the cancer patient, like somebody is suffering from a liver cancer or kidney cancer, if he will be given a transplant, it is very easy to remove the erase the cancer at all. But what Roten Nitin is saying, it is totally different. Roten Nitin, you would like to comment on that?
Yeah, because the anti-rejection drugs that are given do have tendency to bring the cancer back. So in case it is not fully cured or there's a tendency of those cells still there, they don't want it to get escalated and accelerated for
Okay.
development.
Yes.
So
Okay.
that is the protocol, but I'm not
Yes.
sure uh,
In about
is
India,
it
yes.
mandatory or not. But I suffered. I had to wait.
Yes. Dr. Monis, what you say, because in the hospital, you are also having these protocols in India. What you say about what Ms. Saxena and Mr. Justin said, and what Mr. Dr. Nitin has mentioned, his own case. What is your take on that?
Good evening, everybody. Thank you, Asta and Justin, for your time, and presentation was very good. Now, see, with respect to cancer, what happens is, in patients having an active cancer disease, transplant is a strict or an absolute contraindication. Okay, to begin with. Now, what happens is, once you stage the cancer, like how Rotary Nitin expressed, once you stage the cancer, you talk about the spread or the metastatic, or it is contained, or the histological types, the cellular diagnosis. Based on that, suppose, for example, somebody's got a breast cancer. Breast cancer has got 10 different subtypes. Some are hormone sensitive, some are hormone resistant. So based on that subtype, you can actually talk about a clinical recovery. So this is where I think, as a psycho-oncologist, you have to partake with the clinical decision making of your oncologist, so that you know what happens. And with Rotary Nitin's very one strong marker talking about the anti-rejection injection, what happens is, honestly, when you're on a cancer, you're on immunosuppressive therapy, because now you have to take the recipient kidney. Just imagine you get a recipient kidney, and even that kidney fails. Okay, now this is a scenario which we want to avoid 100% by any means. So the doctors will have to work on saying that, okay, fine, he is cancer free. Usually, when we have a markup or like a follow through on these kind of patients, we have two or a 5-year survival rate based on the type of the cancer, the subtype of cancer, and this is how it goes out. And this, I think, Rotary Nitin's story is a remarkable story. Unfortunately, yes, he'll have to wait for 5 years and go through it, so that he can have a longer, happier life, rather than getting the kidney, losing that kidney and being on a long-term dialysis. This is what. So I think having a role of a psycho-oncologist in this part actually fills in a huge vacuum, what we need in the society at large also. Yeah. This is what I purely understand from the case finding, which has been expressed right now. And at the outset, your flow of thought and your flow because the organ donation is one thing in India, like Justin put it, as an opt-in mechanism. It's the uptake is so less still. So we have to catch people young, at least put the seed in their head, saying that this modality exists, because even doctors don't talk a lot about it. It's not something which is a stigma in the society. It is there, but doctors don't talk about it because the awareness is not there. They don't know how to approach, how to attract, how to diagnose, or how to refer a particular client or a patient, But these options make a huge life-changing scheme once you get a transplant done. Thank you, Asta. Thank you, Justin, for your time. I hope
Okay.
question.
Thank you very much, Dr. Monis. Yes, Rotarian Girdhariya.
Yes, I wanted to ask one question. In your opinion, Ms. Asta, kidney is a different matter altogether. A kidney patient having cancer can wait probably for 5 years to cool for as a cooling period. But if a person who is having a liver cancer, he cannot survive for 5 years, if the cancer has spread that big. So what happens to that person? A cancer patient with liver cancer, can he get the transplant done? Or should it be done?
Sir, if the cancer is metastasized, then I think there's a chances are quite less, because then you will be put, the patient will be put on the high advanced chemotherapies and the radiations at once, and maybe that will create more, difficult to do the transplantation. And even if you look at the individual, also it will become difficult for the person to handle all the procedures at the one time. So I think the organ donation is depends on the stages and the grading of the cancer itself, right?
So
As the sir mentioned, all the cancers are different and all the organs are different. So all these things, organ donations are also cancer specific.
yeah, okay. Can I ask one more question about this?
Yeah, sure.
If a person who had hepatitis C
Mm-hmm.
and converted into a liver cancer, so hepatitis C is it never gets out of the body. That's what I understand. It's incurable almost in the later stages when the cancer has developed. So that person is probably not fit for transplant at all. One should not donate any organ for that person, na? Is it right?
If there are chances, there is a genetic testing that we don't talk about much in India. But if we have a predisposition of any disease or any genetic cancer or anything, so it is highly advisable to go through a genetic testing first, so that we will know what are the risks. Then only we can donate our organ. So just imagine if we don't know that whether we have a genetic disposition or not, and we just go and donate our organ. So I think in that manner, the other person might suffer from the cancer because there is a genetic disposition. So I guess if we have any disposition of any disease or any genetic factor are there, it is highly recommendable to go for genetic counseling first, so that we can know whether we are a perfect match for the donor or recipient or not.
Okay, thank you very much. When we are talking about the transplantation, you were saying about the artificial, although there are no such things, it's still in a process. But the xenotransplantation has already been taking place. Don't you think the xenotransplantation will be suitable and can be given priority in the cancer suffering patients? Xenotransplantation means the organs from an animal, like from pig. They are transplanting kidney or the liver or heart.
I do have come across all these news, but to be honest, I don't have much idea about all these things, and that's why I don't want to make any.
Okay, thank you very much. Dr. Santosh Kumar. Dr. Santosh Kumar. Yeah, please.
Correction, yes. I mean, Girdhari sir just spoke about hepatitis C. Hepatitis C is curable. Hepatitis B is incurable. He got that thing changed.
I would like to, my understanding may be less, but any advanced stage of hepatitis C, what I know, is not curable. Where the cancer is spread because of hepatitis C.
So what is happening is hepatitis A, B, C, D, E. You've got 5 types of viruses. Now what is happening is, yes, if the liver goes into a stage of cirrhosis or cancer, it takes that long for the diagnosis to happen. I mean, yes, it is incurable.
That's what I meant.
If you're caught in an early stage of hepatitis C,
yes,
it is curable. Yeah.
Okay, thank you very much. Dr. Santosh Kumar, you have a question.
No, I don't have a question. I just have a comment that yes, though this psycho in the oncologist stream is a new thing in Indian context, but I think more important, even in the case of normal in case of the organ donation itself, the psychology plays an important role. motivating the donors, even the patients, so, kind of giving the counseling for and alleviating their fears about the what happens after and all that. So it does make a huge impact, and we must promote it not only in cancer but all kind of the organ donation. I think I have must have shared my in my previous experience that one of the patient came, the deceased who and the we try to motivate the relatives that why don't you donate, child is very the organ to the other. There are many patients in the hospital which will be benefited, and the response of the patient parent was, we will do it next time. I mean, such a kind of remark that you can't wait for somebody else in the family to die and then they will think of something. But still, and this is the right time to, in fact, people have donated. So he was not only about the organ donation, but yes, about psychological counseling. Our approach should be that we hit to that level that we are able to motivate the people about especially those who are whose relative has died and they can donate their organ to other patients.
And
So
I
this is what
just
I
request
say.
members to keep themselves on mute, please. Yeah, Rotarian Dr. Kamal Jain, are you there? If yes, please switch on your video, Dr. Kamal Jain. Okay. Now, whosoever wants to ask a question, please raise the hand. Rotarian Gidhari Agrawal, just 5, and let's have someone else. Then I will come back to you definitely. No, if nobody is coming, yeah, Professor Sudhir Saran, yes, please go ahead.
Justin and Astha, very good presentation. Thank you very much for the material that you collected. The question I have is different types of cancers in different organs of the body have different seriousness today. We don't know which is how serious. So since you are looking into psycho angle, mental size of the story of oncology, is there a way to educate the lay people that certain cancers are not to be worried at all, whereas certain are that require a lot of care to come out of this one? Is there classification of cancers which can benefit from psychological counseling more than the others?
Well, I would like to actually answer on that, sir. So there is no, I don't know whether there is any particular hierarchical position in terms of the or in terms of classifying cancer deadly or not, but most likely the pancreatic cancer, kidney that affects lungs, all these are like more severe than the other ones. But in general, early diagnosis is a key in terms of long-term survival and the active success of the treatments. Say the first and foremost, what we can actually do is to educating the people. We have done a lot of psychoeducation for, say, for example, anyone that are closing to 50 years old. We are promoting them to do self-examination, yearly checkups to make sure that they are on the safer side, just in case we are finding anything that is like abnormal, say any lumps or something like that. Just for the just as an example, they can actually get it identified as early as possible and start the treatment process, which would improve their chances of survival rather than these symptoms.
Okay, thank you very much.
Thank you.
Dr. Kamal Jain, yes, please.
Yes, sir. Totally, this topic is totally different and new for us. I think we have gained much knowledge from this, and definitely today, no questions.
Okay.
But then, yeah, we will study this and whether this can be implemented in India.
No, but what you are saying in India, and they have also given the figures, we all know that India is. Why? Tell me one thing, when Indians are very much emotional, we consider ourselves very emotional in comparison to other countries. Then why the donation rate is so less? If I am so emotionally, it means I am emotionally attached with my family. And we are talking of the family donation because in India, it's a family donation is required. Why we are not coming out and give the donation? One side we say we are emotionally, and our emotional quotient is very high in comparison to other countries. What you say about this?
Sir, sir, is
No,
it to me or the...
Yeah, no. The question is to Ms. Saxena.
Okay, yeah.
So, with my own personal experience, I would like to share like about organ donation. I have never seen my family talking about it, you know. So just imagine people don't talk about it. People don't even know how important organ donation.
No, Miss Saxena, that we know. But the thing is, we are very emotional.
Yeah.
If you do the research on this, you will find that Indians are more emotionally attached with their own family. We are very family-oriented persons than the other country nationalities. So why it is so that we are not donating our organs? I am asking you, as psychologically, is there anything, any psyche which is barring us to donate to our own family? Forget about others. We are not talking about others. Our own family, there are cases when they are not interested to donate. They say, no, sorry, we will not donate. That fear is there, or some barrier is there. What is that from your psychology and Bill, I am asking?
So this is a very this question
Okay.
is actually this is more related to culture and the ethics that a person grows with, right?
No,
Because
that's why I'm saying our culture is more family oriented.
but
We were taught from the very beginning that he's your so and so, she's your so and so. We have so many close relatives or distant relatives. While in other countries, they have only father and mother. The rest they take even the name by name. They are not bothered for them whether they are auntie or uncle. They just take the name also. So that closeness when we have. Anyway, Rotarian Girdhari Agrawal wants to ask the question. Yeah, you want to say something,
I would
Justin?
like to actually share an experience of my own.
Yeah.
One of my uncle, he had a liver cirrhosis followed by cancer diagnosis. His daughter didn't refuse to share her kidney, her liver to his dad, to her dad, even though he passed away after like 2 years after the surgery. I could actually feel that bond. She didn't have a second thought of undergoing the procedure.
Now my question to you is, your uncle was having any son?
No.
Brother?
That was the only, he had a brother, but
brother has not offered?
No, he to have a.
And you know very well the sibling matching is the best matching, better than the children also. This
But
is
unfortunately, he
this is
had a really bad
yeah,
cirrhosis.
and only daughters can donate to the daughters can donate to the father. Son is always reluctant to donate. This is the fact of the life in India. And here, thank you very much, Rotarian Girdhari Agrawal. Please unmute, Rotarian Girdhari Agrawal, please unmute.
One thing I just wanted to answer your question also, which I had experienced actually. In my wife's case, my son, my daughter, both the daughters and my son, they wanted to donate their organs, the liver. But my wife refused outright that she will not have that. So many cases this happens. This is also ethical bonding.
No, that is where Miss Saxena and Mr. Justin role comes. That is what we are discussing.
Yeah,
I would
yeah.
like to add one point to it.
Yeah.
It's like people have the fear of the afterlives after donation. So when it comes to emotional side as a part, a person can be emotional, but when it comes to being a practical life, they'll think what will happen if I donate my organ, how my life is going to be affected. Or in the Girdhari sir's case, we can see his wife herself rejected the offer by the son and the daughters because she knows that there will be challenges in their life and the kids are young, right? When a certain organ has been taken from your body.
No, Miss Saxena, I disagree with you. There is no young or old. Once you are above 18, you are as good as a 60 or 70 years old if the organ is perfect. Okay, that is one. Secondly, there is no question of rejection by a patient because patient and the child is like same. Mentality, the psychology is same. So one has to understand that if the patient says something, say no, you have to convince, or if you are not convincing, even you have to tell lies to the patient, then it is allowed. Like if your child is not taking food, you always give some excuse. Okay, if you will take food, you will get this thing, whether somebody will give or not. So this thing is this is the reservation in India, and that's why your role as a psycho-oncologist or psychologist is very, very important in India. And that's why my question goes back to Rotarian Dr. Monis. In your hospital, although you don't have the transplant thing, but still, do you have this onco-psychologist for the organ transplants or not, once you are planning to start?
Yeah, I mean, we have a social worker, whose forte is counseling. We have a department of psychiatry. We have 2 psychologists working with us. So we have already spoken to them about, like, especially for organ retrieval, post brain dead diagnosis, they have to start getting active and they'll have to talk to them about it. Yes. So we have a small team like this, but not psycho-oncologists per se. Yeah.
Okay. Thank you very much. Yes. Again, Rotarian Girdhari Agarwal. Yes, please go ahead.
I'm sorry. I mean, I've got a lot of questions.
No, I understand your personal because you suffered, so we understand. Yes. Please go ahead. Shall I suggest you one thing, Rotarian Girdhari Agarwal, if you don't mind? Because Miss Saxena is also from Mathura and you are also from Mathura.
Right.
So if she will, although I know that she will definitely, the psychologists or the doctors are and the advocates are very happy to share their numbers. If they say, I will share her number to you and you can contact and take the things. But still, if you have a small question, you can ask.
I would like to talk to her as well. But what I say, I mean, I have seen many patients where, I mean, he's going hale and hearty, doing his all routine chores, of the daily life. And suddenly when he is diagnosed with cancer, he starts feeling bad and goes down day by day. So I think the psycho-oncology should play a pivotal role for this, those kind of patients. I mean, organ transplant is okay. Oncology is, your psycho-oncology is required there, but probably it will be more beneficial for the patients who suddenly gets diagnosed with cancer.
But I will tell you,
cases it happens.
Rotarian Girdhari Agarwal, we have a member. Sorry, I will just tell you. Then we have a member of our Rotary Club of Organ Donation International. Right now, is suffering from cancer, liver cancer only. But from the D-Day one, he's hale and hearty, very cheerful. He spoke to me several times. He wants to talk, and he says that I am very happy. I have nothing, and fortunately, and I must say, it's a God's grace, he is now out of danger. The Apollo Hospital Chennai has cleared his thing, and now he is only going to get after every 3 weeks one injection, which they say that you have to take 3 injections, and after that they will review if it is required. So it all depends on the nature of your own. If you are happy and if you are not having any fear from the death, then one can enjoy the life. Yes, Miss Asta. I think I've taken correct name.
I was saying how a person reacts to the news of diagnosis depends on the individual. Clearly, the individual differences is there. Same case, 2 person are there in a family and 2 brothers are getting diagnosed with the same cancer, same stage and everything. But you will find the difference in their reaction. One will be very motivated and highly was like, no, everything will be fine. And on the other hand, other will be like, no, I will die. Right. So this is all individual differences. And as Sir said, our role comes with the diagnosis as well. When a person comes to the hospital for the first time for the checkups and everything, for the screening, we can sense the fear. We can sense that they are anxious. Then the fear is there. Like what if we will diagnose with the cancer and what if we died? They have this question mark on their face. So I can understand this thing. The role of psycho-oncologist starts the moment patient steps in the hospital. And the role keeps continue till they are in the remission phase. Or sometimes for some patients are like, they still want to stay connected with the psychologist even after the remission, like for 15 years, 20 years. So I think this journey is depends on an individual. Obviously, our health matters. How psycho-oncologist, help them to overcome all the emotional trauma that they have been through in the past life, in the treatment and everything.
Okay, thank you very much. I think Ms. Rotarian Ruby Agarwal wants to ask a question. Short question, please.
I just wanted to say, this topic of cancer is kind of touchy to me also because my brother passed away with cancer. And at the same thing, I wish we had psycho-oncologist at that time, and we were aware of such people, because his major part of recovery was not because due to his psychological strain that he took, because he was the breadwinner of the family and he was the head of the family, sort of. So that trauma and the relatives coming and giving him a sad this thing, at the time of diagnosis only, people were just giving names, condolences and all that only. So kind of impact it had on him. Whereas one of my close friends recently, and she has got a fourth stage of cancer, but she is into consulting psychology and she's into traveling and she enjoys her life, and she has now cleared all her PAT scans are clear now. She has cleared all this thing. So I don't know, people should accept it and give lot of awareness about such things, that these things exist, and it plays a major role in recovery of a patient.
Is it
So
correct,
thank you for
Ms.
making
Saxena,
me
that
aware.
recovery of a patient depends on how you are
I
cheerful or
have
not
seen a lot
cheerful?
of cases closely, because this topic is touchy to me, and I always talk to people about this, and especially to people who are recovering and all. So I found this very close, this thing as real
Yeah.
important. Yeah.
Okay. Ms.
That's
Saxena,
it.
do you think that recovery depends on how cheerful you are, or how you are psychologically treated so properly you are not having any fear? Or it is the cancer is cancer, whether you are
No,
cheerful or whether you are sad?
No, sir.
now
For
even
every recovery,
Sorry.
there are multiple factors. One is the medicine and the treatment that has been advised by the doctor. You can't just go and decide, no, I don't want chemo, I don't want surgery. No, you can't do that, because this is a very serious disease. Other comes the family support. If you have a positive family support, then you can deal with anything in the life. Then comes the individual psychological state, that is his or her mental health. And yes, it is true. If you are taking a very good treatment, if you're following the every protocol, if you take counseling, or if you are under, if you are in a contact with any psychologist, or if even if the friends and the family support is good, there are high number of chances that the patient will survive and they will be disease free.
Okay.
Even I have seen the patients with the stage 1 cancer, and they died, and there was a chances they could have survived. And on the other end, there are patients like where even the doctors did not have any hope that this patient will survive, but they were highly optimistic and they were highly motivated. They was like, no, nothing is going to happen to me, मैं एकदम ठीक हो जाऊंगी ma'am. And they did survive. After some time they were cancer free.
Yes.
Mental health
Yes. We have also come across such type of patients. Yes. Any other question anybody wants to ask? Or yes, Advocate Assist Shankar, you joined lately, but would you like to ask anything? Please unmute. Please unmute.
Good evening, everybody. It's a nice session and a new scenario of psychology is introduced to the society by this session, I must say. And I'm really thankful to Astha Saxena ji for such a positive guidelines to all the society.
Okay.
Thank you.
So thank you very much. And over to you, Rotarian Ruby Agrawal.
Yeah, thank you so much, Justin and Astha, for such a beautiful presentation and making our Rotarians aware about such important aspect and your field. I wish that this becomes more popular and people consult you without any hesitations. And thank you all Rotarians for attending this meeting. Thank you all. Thank you.
Meeting is hereby adjourned.